Ladies and gentlemen, today we stand at a powerful intersection where science meets compassion, where innovation meets impact, and where our health becomes the foundation for everything we dream to achieve. Good health is not a privilege. It is a basic human right. Yet, millions around the world still struggle for access to proper medical care, preventive tools, and education. This is not just a medical issue, it's a global responsibility. The world we live in is more connected than ever, but so are the challenges we face: infectious diseases, mental health crises, chronic conditions, and misinformation. We can no longer wait for someone else to solve it. We must become the advocates of our own well-being and, more importantly, champions for those without a voice. When we empower people with knowledge about health, we are not just saving lives, we are unlocking potential. A child who grows up healthy is more likely to go to school. A healthy woman is more likely to raise a healthy family. A healthy community is more likely to thrive economically and emotionally. Health is not just the absence of disease, it's the presence of vitality, purpose, and possibility. Let us use the power we have, our voices, our platforms, our choices to support access to medical care, promote mental health awareness, and encourage healthier lifestyles. Whether you're in a lab, a classroom, a hospital, or simply speaking to your friends, what you say, what you do, and what you stand for matters. Let us dream of a world where good health isn't a luxury, it's a norm. And let's work every day to make that dream our reality. Health is a universal right, not a privilege. It's a statement we've heard before, but one we need to start living by. Far too often, the quality of a person's health is determined by where they are born, how much they earn, or the color of their skin. This isn't just unfair, it's inhumane. The ability to access clean water, safe housing, proper nutrition, and medical care should not be reserved for the few. It should be guaranteed for everyone, everywhere, regardless of their circumstances. The moment we treat health as a commodity instead of a human right, we allow injustice to masquerade as a system. Across the globe, disparities in healthcare access paint a stark picture. In some parts of the world, a child dies from a preventable disease every few minutes simply because vaccines, clean facilities, or basic antibiotics aren't available. Women die during childbirth due to lack of trained professionals. Communities suffer because healthcare isn't geographically or financially accessible. These aren't tragedies caused by nature, they're failures of prioritization and policy. We cannot stand for a world where someone's postcode decides their life expectancy. When we talk about universal health rights, we are not asking for luxury, we are asking for dignity. It's about ensuring that no one has to choose between putting food on the table and buying medicine. It's about making sure that a rural village has the same chance at survival as an urban city. It's about saying that the janitor deserves the same level of care as the CEO. Because illness doesn't discriminate, and neither should our healthcare systems. This principle isn't just an ethical one, it's a practical one. When we invest in the health of all people, we build stronger nations. Healthy citizens contribute more productively to their communities. They attend school, they work, they innovate, they lead. But when health is treated as a privilege, we lose talent, we lose potential, and we lose lives. It's time to challenge the structures that have kept quality healthcare behind locked doors and start building systems that open them for everyone. Access to medical care remains unequal across the globe, and the gap is not narrowing fast enough. While some people enjoy the convenience of booking a doctor's appointment through an app or accessing specialists within minutes, others are forced to travel for hours or even days for basic health care. In rural areas, remote communities, and underserved neighborhoods, hospitals are either too far, too expensive, or too under-resourced to meet the needs of the people. This imbalance is not just about logistics, it's about justice. It's about a world where your health should not depend on your zip code. Inequality in healthcare access doesn't only affect developing countries, it's a global issue, present even in the wealthiest nations. Marginalized populations, including minorities, immigrants, and the economically disadvantaged, often face barriers such as language, discrimination, lack of insurance, or limited education about their rights. Many suffer silently because systems were never designed with them in mind. We cannot ignore the emotional and psychological toll this takes when people feel forgotten or unworthy of care. It breaks more than just their bodies, it breaks their spirit. Modern challenges like mental health and misinformation require urgent attention. For far too long, mental health has lived in the shadows, spoken about in hushed tones, if at all. But mental health is health. Depression, anxiety, trauma, and burnout are not weaknesses. They are real, complex conditions that deserve understanding and professional care. Yet, in many cultures, they are still stigmatized or dismissed entirely. People suffer silently, afraid of being labeled, judged, or ignored. And while we have made strides in awareness, access to quality mental health services remains deeply unequal, especially in low-income regions and communities of color. At the same time, the rise of misinformation, particularly online, is becoming a public health crisis in itself. From conspiracy theories about vaccines to dangerous home remedies promoted on social media, false information spreads faster than truth. In moments of fear or desperation, people cling to what they hear most often, not necessarily what is medically sound. This misinformation is not just misleading, it's deadly. It undermines trust in science, disrupts public health efforts, and puts vulnerable populations at even greater risk. And in a world increasingly driven by digital media, combating these falsehoods requires coordinated, creative, and culturally sensitive action. What makes these issues even more urgent is that they are deeply intertwined. Misinformation around mental health, for example, often reinforces stigma and prevents people from seeking the help they need. Similarly, a lack of mental health education can lead to misinformed responses to crises, both personal and collective. Addressing these challenges means redefining what healthcare looks like today. It must include emotional well-being and information literacy as fundamental components. Because we can no longer separate what's in our heads from what's on our screens or in our hearts. It's all connected and it all matters. Empowering people with health education leads to stronger communities. Knowledge is not just power, it is protection. When people understand how their bodies work, how diseases spread, and how to prevent illness, they are better equipped to take control of their own health. Health education is about more than pamphlets and posters. It's about creating a culture of awareness where people feel confident in making informed decisions. Whether it's learning about nutrition, sexual health, hygiene, or the importance of regular checkups, access to this knowledge can change lives, especially in underserved or rural areas where misinformation often fills the gaps left by absent healthcare systems. Health education also fosters independence and resilience within families and communities. Parents who are educated about child development can better care for their children. Young people who understand mental health are more likely to seek help early. Communities that know the signs of chronic illnesses like diabetes or high blood pressure can act before it's too late. Informed individuals become advocates not just for themselves, but for others. They spread what they learn, challenge harmful myths, and push for better policies. One educated person can become the starting point for a ripple effect of wellness. What's more, health education helps bridge cultural and systemic divides. By tailoring education to local languages, customs, and contexts, we ensure that it resonates and sticks. It transforms healthcare from something done to people into something done with people. It promotes equity, dignity, and empowerment. And in times of crisis, be it a pandemic, a natural disaster, or a mental health epidemic, is communities with strong foundations in health literacy that respond faster, support one another better, and recover more fully. Ladies and gentlemen, the truth is simple. Health is not just a sectorate, it's the soul of society. Without it, dreams fade, families struggle, and communities weaken. But with it, everything becomes possible. Progress becomes sustainable. Hope becomes real. We each have a role to play, whether we're doctors, students, leaders, or simply citizens of this world. Let us not wait for change to come from the top. Let us be the ones who demand it, who create it, and who embody it in our everyday actions. Because when we choose to prioritize good health, not just for ourselves, but for everyone, we build a future that is not only healthier, but more human. So let this be more than a speech. Let it be a movement, a reminder that dignity begins with health, and health begins with us. Thank you.